Welcome back to the Karmanos Network as we explore the power of the Karmanos Network and what the team concept brings to you if, heaven forbid, you should get a cancer diagnosis. I'm joined by Dr. Kiran Devisetty, who is Director of Radiation Oncology Research for Karmanos Cancer Institute. Doctor, hello.
Thank you.
So talk about the benefits of being part of a team approach at Karmanos.
So in cancer in general, you need a team and a highly expertise team in regards to the different ways we treat patients. Cancer patients in particular are never treated by just one physician. Often it requires a team of radiation oncologists, medical oncologists, surgical oncologists, all working together in concert to try to find the best care for our patient. Often, depending on the diagnosis, you need some sort of combination of chemotherapy, radiation, or surgery, and by having these physicians working together, we are able to figure out what's best for the patient.
Okay, there's that old adage that there are too many cooks in the kitchen. Mm-hmm. So in terms of coordinating care, how do you go about doing that, and who in the hierarchy with all these different disciplines coming together has the ultimate authority, or is it a collective decision?
It is often a collective decision, and this decision is made in what we call our multidisciplinary tumor boards. Every one of our cancer sites has these tumor boards where all these physicians get together, not only the oncologists, but radiologists, physical therapy, pathologists, all these different doctors get together where we present every patient that has a new cancer diagnosis. We review the whole history, the imaging, the biopsies, and what else is required for the patient, and we speak together, decide together to figure out what's the best treatment for that individual patient. It does require intense coordination. One of the things I tell my patients is at different points in their care, there's going to be a different quarterback, and that quarterback will hand off the ball to the running back. And it's just dependent on what phase of their treatment they are in when that person is the quarterback.
Okay. So we've established that you may have a number of different quarterbacks on the field at any given time. Who ultimately is the coach?
The coach is a unified decision. Now, we do have cancer center directors that make sure our overall program is functioning in a way that provides the best care possible. But often we have individual oncologists that, if they tend to see the patient first, will try to direct the care, but it's always done in unison with other people. The best cancer care is coordinated care.
So what are the benefits to that, as opposed to maybe designating one oncologist to be the chief of your case and then having them consult with others?
What I've learned in cancer care is there's never one way to treat any patient. It often requires a nuanced decision that relies on the experiences of all the different physicians being involved. When you have these multiple quarterbacks being involved, you're drawing from their experience in dealing with this cancer diagnosis and fine-tuning the treatments that we are recommending.
So give me, for instance, an example, if you will, and I know there are all kinds of HIPAA regulations and things like that. So patient X, give me an example that you've experienced where having the different quarterbacks, that maybe someone with the run game had a great idea, but it was when the guy with the better passing game came in and maybe saved the day.
So if you look at one of our most common cancer diagnoses we deal with in the network is breast cancer. And in breast cancer, there are many different ways we can approach someone. One of the more complex patients we have is patients who have a cancer in the breast and in their lymph nodes, which are located in the armpit. In certain situations, we may decide to do the surgery first, followed by chemotherapy and then radiation. Other times, we may do the chemotherapy first, followed by the surgery and then the radiation. And then if you do the chemotherapy first, that can change the way we do the surgery. So there is a lot of different ways we can go. And sometimes, recently, a patient came in where they wanted to do the chemotherapy first. And we asked, well, does doing the chemotherapy first necessarily change the surgery? And it did not. And for that patient, she appreciated having the surgery first because in a lot of patients, they want to have that tumor removed as quick as possible. But there are other situations where there can be benefits to doing the chemotherapy first, and we have to educate the patients as such.
Or they think they can avoid surgery by having a successful chemotherapy.
That is correct. And that's often a big challenge we have to face in both the chemotherapy, surgery, and radiation portion. A lot of patients that I see, being a radiation oncologist, they've already gone through surgery and chemotherapy, and they naturally ask, well, if I've already had the surgery and the chemotherapy, why do I need to do the radiation? And it takes a lot of education for our patients to understand why.
Just out of curiosity, how passionate do some of these board meetings get? Because if you have different specialists with different philosophies, how do you come to an ultimate decision?
Passion is great. And
absolutely. If I'm the patient, I want everybody to be passionate.
Absolutely. You want to be passionate. And yes, there can be, quote unquote, many different ways to skin the cat. And when we work together, we start to appreciate each different point of view, and we learn from each other. I may come in with a certain opinion, but as I talk to my other physicians, they may say, well, these are the advantages or disadvantages of this approach. So long as you have a receptive audience and that they are interested in learning and trying to find out what's best for the patient, we often can come to a consensus decision.
In terms of, many of us look at the Karmanos Institute and think of it as a treatment center, but it's much more than that. It is also a center for a lot of clinical research. Mm-hmm. How is that brought to bear, whatever the discipline may be?
So I'm particularly in charge of radiation oncology research, and one of the big things in Karmanos in general is trying to be involved in transformative cancer care. And the way we do that is through clinical trials. And with our main downtown hub, we have been able to disseminate a very large number of clinical trials throughout our network sites, making these clinical trials available to patients throughout the state. And patients in particular get interested in clinical trials and excited about clinical trials because we're bringing tomorrow's treatment today for them.
Well, nobody wants to have out-of-date treatment, mm-hmm. right? But we often see, and again, this is for my curiosity, sometimes conflicting research. You can have something that a study that might confirm what we knew earlier. It might conflict with it, but do you change established protocols based on one study? So how do you sort through that as you determine what the best course of action is for a patient?
It's not often one study that will dictate a change in treatment. It's often an accumulation of studies. In science in general, if we have one study that demonstrates one benefit, we often have confirmation studies to verify that benefit. As we build up this story in regards to getting all these patients on clinical trials, eventually our guidelines will change to adopt that. We want to practice medicine responsibly, but we also want to take the best of what we have and make it better. And the way we do that is through clinical trials.
Give me an example of some of the breakthroughs or developments through clinical research in the past few years that you have found particularly dramatic or that may have profoundly impacted the course of action on a patient that made a great deal of difference.
So one of the most difficult patients we deal with is when cancer has spread to the brain, something we call brain metastases. Right. And often in that situation, we have to do what's called whole brain radiation. Now, unfortunately, when we do this whole brain radiation, there can be some long-term effects, often with their memory. And so we recently had a clinical trial open where it looked at different techniques in regards to sparing the memory of these patients. If we spare the memory of these patients, it can translate to an improved quality of life. So we did a clinical trial looking at the standard treatment versus the memory-sparing treatment and found the memory-sparing treatment was leading to better preservation of memory, thereby improving the quality of life in a very difficult situation. Right. And this is something that has changed the standard of care.
From the standpoint of a physician practicing at Karmanos, talk to me about the trickle-down of the clinical research being done there to the facilities that are out county and throughout the state that are part of the network. How quickly does that happen? We know that communication in any organization is key, but when you have something that is going to change the way things have been done, just by the very nature, sometimes you get resistance. So how fast does it trickle down, and how powerful is that in terms of sending that out into the various satellites?
That goes to leadership and culture. When you have a leadership at the top that is vested purely in trying to make sure medicine gets better and in clinical trials, that trickles down to the rest of the institutions. Once you have that good leadership, strong leadership, and have that culture that is already established in that downtown hub, you find the right people to translate that culture over. And so that was one of the roles I played within our system, trying to bring that culture, establish that infrastructure, and get the buy-in from the top down. It's never one person that can make a program succeed. It's the whole team that you assemble. And when you bring in this excitement, you bring in this energy, you bring in these ideas, and you say, this is for the patients. This is for making medicine better. And when you lead by example, it eventually brings everybody in.
And so you break down the silos and the culture that said, but we haven't done it that way before.
And that's naturally resistance, not just in medicine and everything in general. In Karmanos in general, when we implemented this clinical trial system, within 1 year, just 1 year, we became top 5 in the country in certain types of radiation accruals. And that was within a network community-based setting. And we've set the example for many other institutions and systems to look at how we've succeeded in that way.
And results are what matters.
Absolutely.
Dr. Devisetty, thank you so much. And we will be back with more as we explore why you have a network advantage and the power of that network, the Karmanos advantage, next on WJR.